Hi, this is Dr. Chris from Cedar County Veterinary Services. Today we're going to talk a little bit about canine arthritis. Certainly one of the more common conditions we see in older dogs and definitely prevalent during hunting season, especially after a long weekend out after the birds. Today Pavlov and I are going to show you some of the things that we look for when we're testing for arthritis in a dog and a couple of options we have to manage pain from arthritis. Essentially, anytime we have a dog come into the clinic that's a little stiff and sore, we always start with a basic physical exam. Do a basically nose to tail exam, make sure there's nothing obvious going on, and then we kind of hone in on any problem areas. For a lot of our hunting breeds like Labradors, it tends to be hips and maybe those knees that take a bit of abuse during the hunting season. Let's see if we can get him to roll over a little bit for us. And starting with either the painful leg or sometimes the non-painful leg until it's just as much. We definitely want to check both of them. We'll run our hands over his back, go down to that pelvis, really make sure we flex that hip and extend it all the way out. Make sure we've got good range of motion there. When we're doing this, we're looking for signs of crepitus, or essentially the crackling feel you get in your own knees when you stand up after maybe crouching down for a long time, kind of that painful grinding sensation. And that's certainly what we see in dogs with some arthritis changes too. We'll move down to his stifle and make sure everything there is feeling good. Certainly want to test that little patella. Make sure we don't have a cruciate tear, anything like that going on that can certainly result in some lameness. Move all the way down to the hock. And then certainly finish up with an exam between the toes. We know foreign bodies like stickers between toes can cause a surprising amount of lameness, even if it seems like a relatively benign thing. We'd certainly switch over and do the other side as well. During a complete orthopedic exam, probably also do a gait test where the dog runs up and down the hallway. Make sure we're not missing anything that could be telling us where the dog is painful and the most effective way to treat it. If we do diagnose arthritis in a dog, we have a couple of different methods we can use for treatment. One of them is non-steroidal anti-inflammatories, essentially doggy aspirin. Certainly we have a range of products available for that specific purpose, a little bit safer than human products to make sure we can deal with the pain of arthritis. A new treatment modality we've recently acquired here at Cedar County Vet is therapeutic laser. It's kind of a crazy looking instrument, but does really neat things for our patients. We know some of the benefits of therapeutic laser include decreasing inflammation and damaged tissue, and certainly stimulating good blood flow to the area so we get a nice healthy healing environment. So we'll do a little demonstration with Pavlov here. It's not painful at all. It's a little bit different for him the first time. So we're going to target his hips to begin with and make sure we have all of our settings the way we want them. And then I'll just go ahead and start applying this. You can see we've kind of got a red guide light here. That's not the laser itself. The frequency we're targeting you actually can't see, but it can damage the retina. So we use that guiding light to make sure we don't get it anywhere that we're not comfortable having that light shown on. So do a couple areas here on his hips. We can do up to a minute on each location that's being a problem for him. Move down to the knee, target that area a bit too. Certainly we would do the inside, do the top, do the bottom, and do any other areas that are a little bit painful. Then usually we flip them over and do the other side. Even if it's one particular knee or hip that tends to cause the most pain, we know they tend to favor the other leg a little bit more. That makes them put a lot of extra weight on that side. So we want to make sure we're treating the whole dog, not just one specific joint that's causing the most issue. So again, a new option is laser. We have our old standbys like our non-steroidals that we can use to manage pain, and certainly a major indicator of quality of life for these older dogs and even young dogs that are very active during this particular time of year. Again, Cedar County Vet is happy to help with any of your arthritis issues, and we'd love to see your dog and see what we can do to make him feel a little bit better, give a little bit more to you during this hunting season.